Hi everyone, welcome to Emergency Care. So, this is our first video. Today, we are going to learn about START triage. So, what is START? Okay, so S stands for simple, and T stands for triage itself, A for and, R for rapid, and T for treatment. So, yes, so where are we going to use this start triage and why should we use this? So whenever there are mass casualties or when you find many patients arriving to the emergency department at the same time and you have very limited resources or less number of doctors, so in those situations we have to prioritize the patients. So to whom should we treat first? Based on the severity of the condition we have to prioritize them. Okay, so in start triage we have this color coding. So what are the colors we use in start triage? So let's begin. So we use red, which is immediate. We use yellow. Yellow stands for delayed. We use green. Green is for minor. And black. Black is for deceased or dead, or we can also say expectant. Now let's see how are we going to triage them, or how are we going to categorize them into different color coding. Okay, so first whenever you see a patient, first look if he is able to walk. If he is able to walk, then he comes under minor, which is a green. Okay, if no, he is not able to walk, then what should we see? Now it starts assess. So assessment, what are we going to assess in a patient? First step will be breathing. Is the patient able to breathe or not? No. If he is not breathing, so what should you do? Open the airway. So how are you going to open the airway? Two maneuvers. Head tilt, chin lift. The other thing is jaw thrust. Okay, you have done this thing, but still there is no breathing. Then he comes under the black, which is dead or deceased or expectant. That is, there is very less chances of his survival. Dead or deceased, there is no chance of his survival. Okay, okay. So if yes, he is able to breathe, then what should you do? Count his respiratory rate. If it is more than 30, or okay, we'll categorize him under red, which is immediate. If the rate is less than 30, okay, if it is a normal respiratory rate, so then what are you going to see? You are going to assess his perfusion status. So how are you going to assess his perfusion status? By looking at capillary refill time. Okay, if it is more than 2 seconds, you categorize him under red. If it is less than 2 seconds, then what are you going to check? You are going to check his mental status. Like you are going to ask his name or age. Where is he now? Okay. So yes, if his mental status is good, like he's able to answer whatever question you are asking, then you can categorize him under yellow, which is delayed. If his mental status is not good, if he's not answering well, he's confused, then he comes under red again, which is immediate. Okay, so it's very simple. We have only few steps to triage a patient. So first, always look if the patient is able to walk or not. If he is able to walk, he comes under minor, so you can wait for some time. Okay, then if he is not able to walk, then start assessing the patient. Look for breathing, if he is able to breathe or not. If he is not breathing, open the airway. If still he is not able to breathe, then triage him under black. If the patient is able to breathe, then count his respiratory rate, how many times he is going to breathe in a minute. So if it is more than 30, that is he is tachypneic, so consider him under red. If it is less than 30, look for perfusion, like you can look for capillary refill time. If it is more than 2 seconds, then he comes under red, so he needs immediate treatment. If it is less than 2 seconds, you are going to assess his mental status. So if mental status is good, then he comes under yellow. If it is not good, it comes under red. Okay, thank you.